on, Rebecca.
Stop her.
Back, Rebecca.
Okay. All right, well, I can start. So we're here with mostly good news. We want to talk about the health of our healthcare plan, and it's going well, and it has been going well for about 3 years. And if you recall, 3 years ago we had a 0% increase. A lot of that was because of COVID. Then it was a 7% increase on premiums with no change out-of-pocket expenses. That 7% that we did 2 years ago was well below what medical inflation was at the time. 0% last year, and now, based on our experience to date, we're looking at a 0 to 3% for next year. Yeah. And so now is the time for us to look at other options, because the likelihood of that continuing, there's a strong likelihood that we won't be able to continue with no changes to out-of-pocket expenses and premiums. So there's some things we can put in place now that would provide options, and the first of which is to look at partnering with QuadMed, a clinic. It would not be an on-site clinic, but it would be a near on-site clinic. It'd be out at Highway 100 and is it the old Tracker out there. So we'd partner with them, and the way that would work is that it wouldn't be something that somebody would enroll into. It would be no change to their health care coverage or anything like that. It would just be an option that they could go to. And so we went and toured the facilities out there, pretty impressed with modernization. They said that they only book at 80%, so it's low wait times. They offer mental health where there's long waits to get in. There's been another option for employees. And there's also options down the road to maybe look at vision and dental and other opportunities to partner with them. The way this would work is that an employee could go there and it would be no out-of-pocket expenses. So if we start to see the need to increase out-of-pocket expenses, co-pays, deductibles, co-insurance, those types of things, there's this option for employees to go where they wouldn't pay that. We would pay a flat amount per employee per month, and like we said before, it's kind of like that car wash concept where if employees use that more than what their cost would have been against our claims, then we're kind of money ahead because it's kind of prepaid set amount. If they use it less, then there's some risk to that. So you need to incentivize it. So one of the big incentives is that it would be no cost. You wouldn't have, they have urgent care, so you don't pay that $50. You have a clinic visit, you don't pay that $25. You don't have your co-insurance, any co-pays to that. You see an MD, they're in the Epic system, so that means all your medical records. One visit could be at QuadMed, your next visit, because maybe you couldn't get in with your primary care provider, could be back there. All your medical records are there. They provide, like I said, mental health services people would have access to. So it's an option for employees where if we need to increase costs and those costs are out-of-pocket expenses, here's kind of where people could go. We're not requiring people to go there. They could choose to go there, and we're hoping that if they go there, they'll continue to go there, because as they go there, those costs are baked into that arrangement where we don't experience them over here in our claims. And so that's an option that we could put in place now when we don't expect to have big increases to out-of-pocket expenses, that it's not something people enroll into. It's an option. The more they use it, the better it is for us. And then we would enter into likely a multi-year contract, like a 3-year contract for that, and then reevaluate expanding that. We have opportunities to expand it to, like I said, to dental, to vision, maybe some work comp provider. We spent a lot of money on pre-employment screenings that maybe could be done there. And, whatever we may be doing with the DPW building, might be an opportunities down in the future to maybe have an on-site location where it'd be very convenient for people. They have more than just one location. That is their main location. They have some other satellite locations that employees could use. They project that within a 3-year time period where they've done this elsewhere, that they see about 60% of employees using them, 30% spouses, 10% dependents. We know we're not going to see that the first year. It'll probably take multiple years as word of mouth. People have good experiences, they return, and they see the advantage of going there as we need to increase other expenses, so be incentivized to go there to not have to experience those cost increases. So, you know, there is some risk, and the risk really is, are we going to use it enough to offset the claims we would have experienced going to their other doctor? But that's where we're saying maybe there's opportunities there that we can mitigate those risks.
Okay, so it's just this, you're just looking to explore it right now.
Right.
One of the other things that you mentioned a few times, the mental health. A lot of times right now, there's a lot of dependents that are going through mental health issues and they can't get in to see anyone for months, weeks and months, and so this would offer an ability to get them in earlier. Right now, what they have to do is take them to the emergency room or to Rogers, so it's not even, it's the amount of visits, but it's also the type of visits. You know, having an inpatient hospital stay versus a visit, there's a big cost differential there, so.
Okay. Good.
Mr. President,
Alderman Weigel.
question I have is if an employee opts to go into this and then doesn't like it, would there be a window where they can come back or no?
They never leave their plan.
They never leave their
It's
plan.
just another place to go.
They're just getting their services there.
Yeah.
It's like an urgent
Okay,
care.
okay, I get it. Yeah, so they, again, this is just going to be a transparent thing.
Yeah.
Right.
They just choose to go there
Right.
instead. Oh, that's, okay.
Right.
That's even better then.
Yeah, it's not something you enroll in. It's not something you choose per visit.
Okay, if there's no further questions, we'll go on to the other item. Rebecca,
The
Health Department.
Yeah.
I'm pretty sure I don't have COVID.
I don't
Got
know.
my test
Everybody's
kits.
throwing masks at Kevin.
I left them in the other.
Allergies. So, was it last meeting that contract was approved with the city of Greenfield?
The service agreement, yep.
Just a service agreement. We were approached, well, Bob was approached by the city of Greenfield regarding filling in because they have no health officer and they have limited staffing there. So they were interested in, well, they need to have a health officer, so they were interested in partnering with us, but they also wanted to have larger conversations about creation of a joint health department going forward. And so given the directions we've had before from the council about collaborative services and things like that, we were looking at finding out if there's an interest from the council before we completely move forward on that. I don't know if you have any more insight.
No, I would just say that their mayor and just leadership is supportive of it. And so I'm in pretty routine contact primarily with their human resources director, who's serving as liaison on behalf of their mayor. But even as of yesterday, they did ask for us to have a follow-up meeting with them because they too, do want to continue exploring some form of a merger, consolidation, or joint. So I think we've got mutually, respective interests here.
Alderwoman Grisham.
Couple questions. How does that impact our residents in our community when you have a joint venture going on with the health department?
Well, at least in theory, it won't, because the current staff that we have now within the West Health Department are exclusively providing services. I should say that we are providing a little bit of support to Greenfield residents right now, without having to reschedule or abandon, appointments at this point. There is a semblance of a staff in Greenfield still, and they do want to maintain a physical presence, in their building, and so I think they're in a position to recruit and hire to build up their own local capacity to give assurance that they can effectively respond to Greenfield resident needs without necessarily having to have a major impact on our department.
Okay. And as far as impact to current staff, does that just increase their caseload, or would you look to hire additional?
So again, they are going to do their best to recruit and hire personnel to support Greenfield needs, and so I think that's part of the challenge is just continuing to advise they go down that path. They have finances to do that, so there is an expectation that they would continue to do that.
Okay, thank you.
Yeah, I would, just from my point of view, I think if we can consolidate with any community, with any departments, I think it's absolutely worth exploring. I think that's something should be a goal of all communities to try to consolidate services to save money for the taxpayers jointly. And I think, you can eliminate.
That was what I was going to say too, that another impact on the taxpayers. I mean, the idea is that the structure, like the health commissioner and administrative staff, you wouldn't need as many, hopefully,
Right.
if you're working together. So eventually then the cost should be maintained and mitigated, not such
Yeah, it
large
should lower for both of
increases.
us.
Yes.
Both communities.
And Mr. President.
Alderman Haas.
Yeah, and I certainly agree with what you just said, Tom, 100%. I think we all had head bobbing there, head nods the right way. Yeah, Bob, your department's already been providing services for other communities, and I don't think that most of the elder people know about that. Already providing services for Greendale and Hales Corners and Wick for Cudahy. Tell us about that.
And Greenfield
And
as
West
well.
Milwaukee.
And West Milwaukee.
Oh, and the entire health service
So,
for
and
the
we
village of West
are,
Milwaukee.
and then it's been, a long-standing relationship with the Village of West Milwaukee that we serve as their health department. Service agreement that you folks have been signing off on for years. So that's comprehensive. But then, we do provide environmental support to the Village of Greendale and have been for years. And then with our WIC program, just because of the size of it, we cover West Dallas, West Milwaukee. We have a satellite clinic in Cudahy as well as in Greenfield already at this point. So, we have a presence, a pretty large footprint as it is. And so really I think this is, just an opportunity for us to, continue to
And we're
assimilate, integrate with other jurisdictions.
And we're looking at creating something that other people could join, and talk to the current people that we are providing services to.
Good. Sounds good. Keep exploring.
For sure.
Anything else to come before the committee?
Just
Oh,
a simple
sure.
question. So bike consolidations would be advantage in the future, say between Greenfield and West Dallas, instead of having two buildings and one building? I mean, it's something to be thoughtful in the future.
Just as many people working.
Part of the exploration.
I might-
Part of the
I guess
exploration.
I'll just say that their mayor does want to maintain a physical
Yeah,
presence
that makes
in
sense.
Greenfield.
Yeah, I would think any community would want at least some hours in their community to provide convenience for their residents, so.
Just a simple
Motion to adjourn.
All in favor?
Aye.
Opposed? We are adjourned.